His cancer came back. He had a surgery and it returned. And now we don't know what his condition is because we can't do the tests.
Without the treatment, my situation is very dangerous. It's life-threatening. My condition will just get worse and worse.
Thousands of Ukrainian refugees like these have fled to Israel from the Russian invasion of their country. Many have been in Israel since the start of the war over a year and a half ago. But on top of worrying for their homeland, they now face a whole new crisis. The Israeli Finance Ministry, quietly and without warning, has rescinded its funding for the refugee community's life-saving healthcare. 62-year-old Elena Kharchenko from Dnipro, Ukraine, has a deadly heart condition for which she's already had 2 open-heart surgeries. But when her city was targeted by Russian attacks, she fled to Israel to live with her daughter's family. While here, her condition has deteriorated, and she was scheduled to get another surgery until she wasn't.
On August 9th, I had a checkup scheduled, but I got a message from the welfare ministry that it was canceled. I called to see why, and I was told that the government decided that from this day forward, there'd be no insurance, and that's it. There's no way to do my checkups or surgeries.
Elena's only option to get the treatments then is if she pays the 110,000 shekel, or nearly $30,000 bill, out of pocket. And this news came just a day before her final pre-surgery checkup. Similarly, Lev Lazarovich speaks about the shock that he received when trying to schedule appointments for his in-laws. Lev's 65-year-old mother-in-law Svetlana has problems with her thyroid, and his 75-year-old father-in-law, Vsevolod, is now battling heart problems as well as a recurrence of cancer. Lev, the only Israeli in the family with fluent Hebrew, manages all of his in-laws' medical needs, and he noticed that Vsevolod's new CT referral expired in less than a week.
I called the welfare ministry and they told me the health insurance will end August 8th. Will it be renewed? No one knows. So I said, wait, what do I do now when my father-in-law has cancer? And on August 8th, I was with him at Rambam Hospital and got referrals for an MRI and a biopsy. But now we can't do them either because we cannot pay the prices for these treatments.
So how and why did this situation arise? Well over 14,000 Ukrainians have fled the Russian invasion with no rights to legally immigrate to Israel, and yet they've arrived here. Most don't speak Hebrew, all of them long to go home. Half of them are young women and children, the other half are elderly, many of whom are coming here with illnesses. To make matters worse, because Israel considers them to be tourists, they're not entitled to health care. Only those who are over 60 years old received health care under a special government program, but that has just run out. The funding has been cut.
The state of Israel in the last few years basically blocked people from getting refugee status. Theoretically, this status exists, but the state doesn't check these applications. The wave of Ukrainians who flee the war and don't qualify for immigration automatically enter the system as tourists.
But in recognizing that the Ukrainian war will likely drag on, Israel created a unique plan for those incoming refugees. Under the terms of their tourist visas, refugees who came after the start of the war can work, but they're not entitled to certain social services like opening a bank account. Additionally, Ukrainians under 60 years old could privately purchase travelers' health insurance and medical services from Terem clinics, which provides emergency care. For those older than 60 who are harder to insure, Israel approved of a basic healthcare package under Tzav HaSha'ah, a new administrative branch of the welfare ministry. Why this basic and limited package was suddenly defunded, however, is unknown. The finance ministry declined the media line's request for comment. Meanwhile, those who arrived before the start of the war, like Lazarovich's in-laws, did not automatically qualify for aid or insurance at all.
I personally took care of this. I called Tzav HaSha'ah and sent all the documents. In August, I sent all the emails we sent the previous March, which they said they lost. Then I started to call and said, listen, what are people supposed to do? They don't have anywhere to return to. Their cities are under shelling. What do they do now? Then, about 2 weeks later, they approved the basic over 60 health insurance plan via Menorah Insurers and the National Insurance Institute.
Still, with the recent cancellation of healthcare funding, it's back to square one. And with no end in sight to the Russian invasion, as well as no path to immigration, refugees like Elena, Vsevolod, Svetlana, and thousands more like them are forced to face a harsh reality.
The last of our medicine. When it runs out, we don't know what to do next. In event of an emergency, we can go to the emergency room without paying, but everything else, all the medications, etc., is at cost. And we can't buy the medications my mother-in-law needs for her thyroid. All these drugs in Israel require a prescription. My father-in-law has cancer and a pacemaker. We can't buy his cancer medication without a prescription, and we can't do the regular checkups either. Every surgery, every checkup. A CT is close to 10,000 shekels at the hospital. An MRI is also about 10,000 shekels. I don't know what Israeli family of immigrants or elderly or whatever, which of them can pay for this out of pocket. So we just want a little help with basic health care, like they had until now. It's true, it didn't give a lot of options, but the options it gave were tremendously helpful.
In a potential solution, Israeli Foreign Minister Eli Cohen has reportedly assured his Ukrainian counterpart Dmytro Kuleba that the health insurance policies will remain in effect, and that the issue will be swiftly resolved. But no details have come out yet on how and when the funding will be reinstated, nor why it was canceled to begin with. Reporting for the Media Line, I'm Aaron Porras.